stress and how to defeat it. Big time job.
Yes, it
Today
is.
we want to talk about the impact of stress on the heart, and joining us from UCI is cardiologist Malik.
We thank you so much for being here, Dr. Malik. Now, first of all, nearly everyone I know is stressed. Is stress always bad for you?
So that's a great question. It turns out that not all forms of stress are bad, but chronic stress can have a profound effect on our health because, like the word implies, it's chronic. But what's important is your perception of stress. Turns out, studies show that people who don't worry about their stress do just fine.
Well, that's interesting.
Yes, it is.
I guess I'm going to stop worrying about my stress.
Yeah, stop.
Now, earlier this week, we showcased some of the alternative treatments that you recommend. Now, how do Eastern practices like yoga, acupuncture, and Tai Chi stack up against Western medication, like medications and surgery?
So I'm a Western medicine educated doctor, and I was quite skeptical myself. Didn't learn about any of this in medical school. And what's really interesting is that the scientific evidence for these alternative treatments is starting to really stack up. And things like yoga, Tai Chi, acupuncture kind of stop stress in its track. They stop the fight or flight response in the brain and cause you to calm the brain and relax.
We had the one guy on the air, remember yesterday or the day before, where he said the Tai Chi has changed his whole life.
Totally
He was
believe
raving
that.
about it.
And the yoga, and
Yeah.
even just taking a few minutes to breathe, if that's like meditation.
Right.
Exactly. And especially in chronic conditions, like even conditions like blood pressure. The Susan Samueli Center for Integrative Medicine did a very interesting study of acupuncture, and just 30 minutes once a week for 8 weeks caused a decrease of 8 to 16 points in blood pressure.
Okay.
That's very comparable to medication.
You have to tell me if you do acupuncture. I have to see that to believe that one. Now, are you ever too young to be concerned about stress? Because we talked about students. Remember, Paul, this
Yeah.
week we had students that were under so much stress. So should you be concerned with a young one who could be concerned about stress?
So stress can affect us at all ages, even children. And what happens is we may be able to be more resilient to stress in our 20s and 30s, but it catches up with us because it's a feedback loop. We, over time, deplete the hormones that help us be resilient against stress. And it also changes our brain. So stress shrinks the part of the brain that makes us focus, makes us perform, and it increases that part of our brain that deals with fear and anxiety. So it feeds on itself. And it's important to, some people intuitively know how to break that cycle, but other times you need help in breaking that cycle.
Can it actually be defeated though?
So yes, it can. And sometimes you're born with the right genes and you're able to do it on your own. Other times you need help. And some of the very, like you were mentioning, Pat, the techniques that work the best have to do with deep breathing. So in yoga, in Tai Chi, in meditation, deep breath is a really important component.
You have a little 3-7-8, is that the breathing?
4-7-8,
4-7-8?
so really close. So I'm gonna have you guys practice with me. Are you up for it?
Sure.
So you're gonna inhale for a count of 4, hold your breath for a count of 7, and then slowly exhale for a count of 8. So we're gonna try that. Breathe in for 1, 2, 3, 4. Hold for 7. 1, 2, 3, 4, 5, 6, 7. And exhale slowly. 1, 2, 3, 4, 5, 6, 7, 8. What you just did right now is shift from fight or flight in your brain to a relaxation response.
I feel more
We'll have to keep doing that.
relaxed.
Doctor, thank you so much for coming in with us and helping us out all week long too. We appreciate
Thank you
it.
for having me.
Well, up next here at 5.